Hi everybody, Tim Wyatt, clinical specialist here with Aspen Rehab. We are here with a patient of ours who has recently undergone our antibiotic 2-week post-op prevention program. She has had a history of contracture in the past, correct?
Correct. I had my first breast augmentation when I was 18, and of course I didn't heal correctly because I was excited about, oh, I got boobs, and then, I looked and okay, everything should be fine because it's my first boob job, and 8 years later I noticed, hey, something's not looking right. Why is one why does one would jump and the other one stayed still,
Right.
And it really hurt me because you think, oh, just because you get a boob job or cosmetic surgery you should look perfect. You trust the surgeon. You
Right.
should have perfect results, and that's when I discovered I had capsular contracture and how common it was for a lot of women with breast augmentations.
Right. And yours was the classic contracture sign where the one side was sitting higher. That's the first sign of asymmetry, is you see one breast sitting higher in a bra or bikini. That's what we tell all women to do as a self-test, is look in the mirror in a bra or bikini. If you see one side sitting higher, or even both, definitely speak to your surgeon about it. And were you having pain in your breast?
I was having slight pain, but what I did notice a big difference was my profile view. One breast had the classic teardrop shape, which was perfect and ideal what I wanted, and the other one had a hump on top, and I was like, okay, this isn't normal, this shouldn't happen.
And then the firmness associated with it. So when you squeeze the breast, you'll notice that the encapsulated side was firmer, whereas the other side was squishier and looser. Right.
Yeah.
Okay. So these are the classic signs of contracture. Now you had a revision surgery to correct that, and your surgeon incorporated you into our program, which was a 2-week after surgery prophylaxis or prevention program. And the reason why this program is so important and successful is that even with great surgeons, and you had a great surgeon, even with great surgeons or a different implant, or now they're using strips of skin or no-touch technique and all the surgical tools, is capsular contracture is really the patient's immune system and response to the procedure, and even a good surgeon or a good patient who massages can still get contracture. So our pretty much premier program that we're doing now is prevention. So exactly at 2 weeks after surgery, what we do is we bring the patients in. It incorporates a medication routine. It incorporates the technology and some of the other things that we do here to basically suppress the immune system so that we never even get to the point where the body does what it typically wants to do. And if you look at the research and the data, you can see up to 70% of all capsule surgeries will result in another capsule to some degree. So that's what we wanted to prevent with is having 2, 3, and 4 surgeries. I've had patients that have had up to 7 surgeries, and they keep trying surgery over and over, and we tell all our patients, it's not that the surgeon did anything wrong, it's not that it's the implant or the procedure, it's that you, the patient. So what we do is, with our technique, is keep that immune system from wanting to re-encapsulate. Now, in your course of care, we did the prophylactic prevention treatment. We did a little bit more treatment than normal with you because we got it soft and we got it down, but hers was a little feisty. So we added on a few treatments. Kind of tell women just in general your experience. Is it painful? Is it uncomfortable?
Experience, living 8 years with, this deformity, and feeling horrible, and, ashamed that it's, it wasn't my surgeon's fault. I felt, fault on my end because I didn't do the research about this. I was too caught up, oh, I'm fine. And so this time around, when I did my second breast augmentation, I did a capsulotomy. They cleaned me out, did a pocket revision, and then I wanted to do everything in my power to make sure I didn't have this problem again. I put so much money into the surgery. Why not put a little bit extra into guaranteeing that I will have the results I wanted?
And that's a good point. Doing the surgery comes with a cost, and even surgeons sometimes lower their surgical fees, or they'll give you a reduced rate, you still have to spend the money and the time out of work and recovery and the risk of, you know, infections and surgical complications. You know, we try and emphasize the importance of prophylaxis and prevention, where you're spending all this time, energy, and money into surgery. Put a little extra effort in doing, you know, the Aspen prevention treatment, because if not, that risk of then having it happen again, you know, and this is something we have to start early. You can't wait. So this is not something that you do the surgery and you wait and wait and wait, and then all of a sudden 3 months or a year later encapsulate.
I think I contacted you guys before I had my surgery and like a couple days right after.
Right.
Because I wanted to make sure, like, hey, I'm fresh out.
Yes.
Is this okay?
Yeah, we pre-schedule. So patients that have this, we let them know in advance. We know the surgery date, and then we get started.
Yes.
Tell me a little bit about the actual treatment itself. Does the treatment hurt?
The actual treatment did not hurt, but it does require a lot of responsibility on your end, because, you know, like the doctors and you guys can only do so much. It's up to us at home to follow through with it if we really want those results.
Right. So we give you a home program. We actually gave you stuff to do at home. The treatment is rendered here. We give you a home program, so nothing too hard, not too complicated.
No, but I did like how your team was very, like, the energy, but also very on top of me.
Yeah.
So I needed that, and I bet a lot of people do too.
Yeah. So our clinical staff makes every effort to make sure we get the best outcomes with patients. So we do put a lot of emphasis into educating. We have to let you know. And on top of that, you were also educated on prevention. So now that we've treated you and you're doing great, so we just did the examination on you. Both breasts are equal, soft, level. You look great.
Thank you.
And now we're in the position where you're discharged, and we've educated you on things on how to not get contracture back. So simple things like stretching your pecs before you work out in the gym. Stressing or straining a pec muscle can cause contracture. Going to the dentist and taking an antibiotic is important, because things like dental procedures or even colds, flus, and infections can trigger contracture. So that's some of the value of the treatment as well, is not only treating the condition, but showing you how to not get it back in the future. Great. Well, thank you so much. This is very helpful. You know, we do these videos because we want real live patients to give their experience on the Aspen treatment. Any questions or concerns, please call us here. Main number is 954-341-7811, or you can go to aspenaftersurgery.com. All right, thank you so much.
Thank you.